Thanks. Great. I'm embarrassed, blushing. Thank you so much. I'm thrilled to be back here. I love this conference. I love this space. I miss this space. And just because of who I am, I'm kind of always the square peg in the round hole. I'm always looking for those points of convergence. You know, where are there markets emerging, underserved needs, places where technology has not caught up with the need? Certainly in the life science space, as Kevin said, you know, the biology, where the early stages of computational biology were emerging, it was obvious where the intersection of advanced technology was going to have a catalyzing effect on healthcare, on disease, on the industry at large. So as I said, I'm kind of the square peg, and I'm always kind of peddling my wares in places that I go, and I'm now at Microsoft peddling my wares. And as I said, global risk informatics. I've been noodling on this idea of, you know, where do we see this next horizon of where there is high degree of need, extraordinary complexity in science, in technology, in access, in the dynamics around globalization, on geopolitical risk. Where are these things found most significantly? They're certainly found in global public health, where, again, the technology has clearly not kept up with the need to both understand risk, mitigate risk, find the right kinds of trajectories to manage risk at a policy level, and how do you protect the most vulnerable people in our society? So I've been looking at this and saying, gee, is this a place where high-performance computing, large-scale data analytics, and the things that are becoming commonplace today, can they fit here? So let me take you through my thinking about this. So this is a perfect example, and I've borrowed liberally from some colleagues of mine at the Global Pulse Initiative at the UN, who we work pretty closely with. So if you take this as a case point, so the global economic crisis in 2008 set a shockwave through society, through the world, right? Lots of bad things happened. We all know in the United States what happened, but in the most vulnerable populations, really, really bad things happened. And while policymakers and leaders knew they had to protect their citizens, they needed to take immediate action and begin to put together policies and strategies to how do you protect people, whether it's on the health front, on the job front, on the poverty front. Just let's collect the data. Let's figure out what's happening in the field, and let's see how we mitigate risk for these populations. Well, it sounds pretty straightforward, but actually it really is not. For those of you who are in any way associated with the developing world, and this takes me back all the way to graduate school when I spent a ton of time in this space, household level statistics or statistics on the baseline take months, if not years, to gather and validate. You know, people go door to door, you're gathering data, the actual data that you're gathering, you don't even know that the data is actually, from a definitional standpoint, you're comparing apples to apples, and this is actually a complicated space. And so this notion of information gap is actually quite real. And this is just a great way to capture. You have human welfare on the left here and time on the horizontal axis. And this is not just in the developing world. We see it certainly in the United States, which still has extremely high infant mortality, which is astonishing. But you have an onset of a crisis, and you have this gigantic gap in time between when you're actually gathering information about what's going on and the associated impacts, and then you have this kind of secondary effect where you're beginning to see harm happen, and then finally, first data becomes available way out. So how do you begin to think about this problem set and impact it in a fundamental way? How do you change the equation so that at the onset of the crisis, even maybe before the crisis starts, you could begin to anticipate based upon either ambient data or some kinds of sensor nets that are out there that help you help you get in front of crises, or when crises happen, how do you get in front of it as quickly as possible? Because there are real consequences when you don't. And these consequences not only happen to the most vulnerable populations, but as you can see what's going on in both the Middle East and Africa right now, things begin to spiral, and all these things are highly intrinsically related. You know, poverty, disease impact national security, they impact our economic security globally, and all these things are quite tightly aligned. But what if you actually had access, decision makers, policymakers, and whatnot had access to real-time data and tools to detect these early warning signals? And I'll give you a really interesting example. As I mentioned earlier, the Global Pulse folks, there's a colleague of mine, Robert Kirkpatrick, who runs that program, And they were looking at some weird ambient data. And one of the data points they picked up was that in India, there was clothing, this cloth that had suddenly seen a spike in certain regions of India. It's this kind of a cotton cloth. Well, it turns out, if you begin to put the data together, when that spikes, you realize that infant mortality in that region is going up because that's what they bury. It's a burial shroud for children. So how do you begin to pick up this ambient data and put it together in a more cohesive, intelligent fashion, be able to model it, run scenarios around it, and make better decisions? So how do you tailor interventions based on real-time data and analysis? So that brings me to why I'm here and Microsoft's role. So labor of love, literally. I've been working with the Gates Foundation for the last 18 months. I've been at Microsoft for about 2 years, and I immediately jumped into this whole area because I felt that it instantiated a lot of the work that within the technical computing organization we were trying to understand and learn from and propagate out. So could we begin to think about this space of global risk as a test case of how we apply simulation modeling to really dramatically change outcomes in places that are atypical? We all know how you can apply supercomputing to design cars and planes, and we use it now to computational modeling for drug design. You can all know these kinds of very traditional test cases, but can you apply it to things that are much less structured? Can you apply it to things that are not in sort of the physical, physically articulated in terms of mathematical models, things that are really all over the place? And that's what I've been spending a whole lot of my time on. So the work that I'm doing specifically focuses on a project called VCDN, the Malaria Control Development Network. Malaria is a bad disease, and Bill Gates at a recent TED event came out with a little, I'm not doing this, by the way, because it's way too scary, but he came out on stage to talk about the impact of malaria with a little jar. And as he's talking about the impact of malaria, he's unscrewing the jar, and out which came zillions of mosquitoes, and the audience was completely freaking out that suddenly he had introduced malaria-biting mosquitoes, which he said, calm down, but all of you realize that half the world's population is at risk of malaria. And it's astonishing that we are in 2011 and that is still the case. The malaria burden is huge, and mosquitoes are horrible creatures, and I'm zip-locking my children this summer. They are not going outside. But the death count here actually is understated because one of the data problems is we don't have great ways to capture when death happens in the developing world. The actual incidence is much higher, the reporting is very low, and this is a real problem. So today, there's lots of ways that people try to manage malaria. There's bed nets, there's insecticides, there's a composite of drugs, and there's lots of challenges around each one, and some of them are just seem so obvious and so simple, but they're not. Human behavior is a problem. Helping people understand how to manage when to put up bed nets, when not, when to get your vaccine, when to take your pills. Just getting information into the field is challenging, not to mention some of the technical challenges that vaccines, for instance, degrade in their efficacy without proper refrigeration. How do you get vaccines into the most vulnerable, high-impact areas and keep them cold? So there's lots of stuff that the Gates Foundation focuses on to manage some of these incidental kinds of challenges. But the bottom line here is that there's lots of things that work, and we don't know yet why they work here and why they don't work there. Is it climate? Is it population? Is it a different malaria vector? Why? The transmission models are complex in and of themselves. So the goal of the long-term goal, Gates Foundation always thinks big, is eradication. How do you get rid of all malaria and mosquito vectors on the planet? And it's been done before. There have been some diseases that we've been able to eradicate. It's not easy because there are latent infections and there are animal reservoirs, and there's lots of things about malaria we actually don't quite understand. And I know just enough to be dangerous now. I am not a malaria or infectious disease specialist. But what I am is someone who understands the role modeling and simulation can play in some of these really complex scenarios. So we are in the earliest stages of an engagement with the Gates Foundation to develop, as they call, the CyberInfrastructure and the applications to really analyze what works where, when. So we're building out a cloud-based platform on our Azure infrastructure. We're building a bunch of transmission models and tools to analyze this data. Obviously, we have assets at Microsoft which are quite extraordinary, like mapping and search and all sorts of other visual tools that we can impose into this infrastructure to allow anyone, when you think of an interface, understand the people who are going to use this data are everyone from people who are infectious disease specialists to field workers to policymakers. So we have to think about an environment that allows decision-making against this data that scales to all the different constituent populations that matter. So it is absolutely one of the most exciting, impactful things that I've ever done in my life, I can tell you that. And we are moving into phase 2, where we've built out the architectural framework, the specification document, and now we're hoping come the next 6 weeks to actually start the development work on this. So just to give you a sense of the complexity, this is not an eye chart, I'm not going through this, but there's so many data sources, there's so many levels of ambient data that you're capturing from the field, there's databases, there's infrastructure, there's platforms. This is not simple, and for people who are associated with the Gates Foundation and our constituent populations as a consortia of infectious disease specialists, they're biologists, they're not IT people, and trying to actually meet the language gaps is complicated. So let me close here by talking about, this is really a cool project, it's really exciting, I think it's on the front end of something really important, but there are really big challenges about what we do in this space of global risk. The first is data and what I call data exhaust. Okay, so there's classical data problems around scale and the integrity of the data and definitions and ontologies and all the things that many of you can relate to just in the classical biology and informatics space. These things don't map. Someone classifies a child, children 6 years old and others, their definition is 13 and others it's 18 and other, just kind of combining data sets. The other is this notion of data exhaust. There is so much ambient data that we want to capture to give us that predictive kind of ability to understand what is happening in the field. What do we need to understand? Cell phones, sensors, all these different things that we could begin to capture. So how do we create an environment that we can capture and make sense of this data exhaust? Collaboration. You know, data owners don't always play nice. People own their data. They kind of hold on to their data. And what has been interesting is that there's something called the H8, which is the largest healthcare policy organizations, WHO, Gates Foundation, Wellcome Trust, as examples. They're now they're beginning to put into policy that grants, to get a grant, you actually have to share your data. So they're making it a component of the overall grant structure. And the last point here, which is something that is hard to kind of get your head around, but it's intuitive. The politics of data. Keeping your population hungry and sick is a strategy. And not every country wants to release data. Not every country wants to do what we think is the right thing to do to protect their vulnerable. So they were in kind of new, uncharted territory. But the bottom line is, from my perspective, again, kind of beginning to put the pieces together. We live in a complex world full of all sorts of risks, okay? And all these risks, I think we're beginning to see how the intersection of these risks create higher degrees of risk. And if we could begin to manage some of the dynamics on the bottom, on the most basic level, I think we'd be doing a tremendous service. So with that, I'm almost there, on time. Thank you very much for your time.